Hi, fluid therapy is one of the more important types of therapy you're going to provide to an animal. You're going to see it throughout your veterinary career, and the main thing we want to convey in the units on fluid therapy would be that there is a physiological basis for the decisions. I'm going to start with the first decision that you generally have to make is the volume, the rate, and the route that you would give a fluid to an animal. In order to understand the appropriate way to administer fluids and to do them safely, you have to understand the compartments of fluids within the bodies and the major forces that impact the movement between particularly the intracellular and extracellular fluid compartments. The first is the hydrostatic pressure, which is basically provided by the pumping action of the heart and the vascular tone, and it's conveyed through the vascular system to the interstitium to some extent. It's counteracted by a force that's called colloid oncotic pressure, which is conveyed by large molecular weight compounds, which are naturally the proteins in circulation. And these counteract the tendency for that fluid to be pushed by hydrostatic pressure out through the leaky endothelial membrane. Well, we're going to focus on in later units will be the concepts of osmotic pressure, and these are provided by the solutes, and they will have a lot to do with your choices of fluids. Will determine the tendency for electrolytes, in particular solutes, to move between intracellular and extracellular compartments. And although it might not be intuitive, I want to say right up front, it's the least permeant of these solutes to the semi-permeable endothelial membrane of the capillary that contributes the most to osmotic pressure. So what are the fluid compartments? I'm showing on this graphic the fluid compartments expressed according to their percentage relative to the body weight of the animal. So the first thing you can note is that the entirety of this of fluids in most animals are going to be about 60% of the body weight. Of that, 2/3 of it is inside the cell, and you can see that right here, 40%. And about 1/3 of it, if you combine interstitial water and plasma, is in extracellular fluid. So recognize that when you administer a fluid to an animal, let's say we're going to give fluids, we're going to obviously have access to the plasma compartment, and we'll give it right here, let's say IV. Then it has to equilibrate with the interstitial compartment, and then it has to subsequently equilibrate between the interstitial compartment and the intracellular water. So this is not an instantaneous process except for you're giving IV into the plasma. And so note that plasma is 4% of the body's volume, whereas, so if we were to look at blood, we normally would say that blood volume, so blood volume, is normally represented as 8%, 8 to 9% of the body weight. Well, what's the difference between these two? Well, you have about 50% of the blood are cells, and they have intracellular compartments, and these are mainly the red blood cells. So if you think about a hematocrit of 50%, you have about half of that being plasma, and that's what you get. So you have to equilibrate the plasma volume, which you can have access to, with the rest of the body, and that's what you have to consider, and to avoid major fluid shifts while you do this, fluid shifts between the extracellular and intracellular compartments. Now we have special cases with regards to the composition of body water relative to body weight, and these include neonates, where that percentage is higher than what we talked about before. It's about 70 to 75%. And in obese animals, where you can imagine there's a lot more lipid, and only 40 to 50% of the body weight. So you have to consider this. You'll come to this kind of realization again when you give certain drugs that only distribute in the extracellular fluid volume. So we're going to talk about breaking the fluid needs of an animal into two parts. First of all, what does it take for that animal to remain hydrated if it's normal? And that starts with their normal water turnover calculation per day. And so what we generally think about is that although the range can be quite variable, as you can see here, somewhere between 50 and 100 milliliters per kilogram per day would be what an animal drinks. And if you think about that, and we can focus to the dog, that's about 40 to 60 milliliters per kilogram per day. That's what you have to give to the animal to maintain it if it doesn't drink. If it has no source of fluids, or if it's vomiting or whatever, that's the maintenance. And if you have a neonate or a lactating animal, they have greater requirements, and they could be as much as twofold more than that. Now, in the next slide, we're going to break this down into sensible and insensible losses, and you'll realize that when you have animals that urinate more, then the maintenance volume will have to be adjusted accordingly. So let's talk about the parts that comprise an animal's maintenance needs. And the first are those that you really can't measure. They're insensible losses. And let's just use the dog as an example, where we said it's normally we would have 40 to 60 milliliters per kilogram per day. And we'll use that number as a reference. So about half of this, under normal conditions, the animal isn't ill in any way, is under normal conditions, about half of that can be comprised of insensible losses. And these include things like normal sweating and evaporation rate through the respiratory tree. Those are difficult to measure. However, in an animal, in most animals, if you needed to, you could measure the urine production, or you could measure the fluid in the feces. These are the two major places that we call a loss is sensible. And we actually get into primarily urine fluid production or an estimation when we catheterize an animal that's ill. And this would be about the other half. So you can see there's about half if you look at the upper end of this. A general rule of thumb in a dog would be about a milliliter per kilogram per hour for urine production. And this translates to around the 24, 25 milliliters per kilogram per day. That's about a half of the total maintenance requirement. So if you have an animal that has increased urine production, you have to sort of parse out the part that's insensible and add a higher amount for the urinary requirements of that particular animal in order for that animal to not go into a dehydrated state even when you think you're giving it maintenance fluids. The other place they can obviously lose a lot of volume is with diarrhea or vomiting, and those things we generally just estimate. So now to focus on the clinical signs you might see in an animal that has extracellular volume depletion, for instance dehydration, or some sort of fluid loss. You would have an increased body temperature, possibly weak rapid pulse as their heart attempts to make up for the lack of volume, pale, dry mucous membranes. What you'll hear about in the clinic quite a bit is CRT, capillary refill time, and anything generally less than 2 seconds is considered to be normal, and anything over 3 seconds is generally considered to be abnormal in most species. In those species where we can, this is feasible to do, pour lack of fluid underneath the skin, say in a cat or in a dog, you can do skin tenting test to see whether they are dehydrated. This is obviously difficult to do in a cow or a horse. They might, if they're severely dehydrated, have cool distal extremities as the peripheral vasculature will contract and try to maintain blood volume. They can show sunken orbits as they're dehydrated, reduced urine output, and if you were to take a radiograph, the heart may be actually smaller in size. So generally we characterize an animal, and this helps us to put a figure on dehydration. We will, if we can detect it, some people say 3%, but I'm going to say most of the time you can only be certain about dehydration that is as much as 5%. And this is based on a combination of understanding the history of the animal. They might have been vomiting or diarrheic. And then there's some indication like slight increase in capillary refill time. Moderate, where you might have history of a longer period of time of the animal sick and more pronounced changes. And then severe is even more prolonged history and more severe signs all along the list I gave you before. And generally, if you get over 12% in an animal, then you are talking about an animal that could die very quickly. These are severe, severe problem. And we call that animal to be in shock. And so these figures are used, whatever we decide, wherever we categorize these can be used to calculate a deficit of that animal that needs to be replaced, and you want to think about that needing to be replaced more rapidly than any other. Okay, it's always a little easier to see and understand something if we use an example. So here's an example. This is an animal that we estimate as being 8% dehydrated. And the first thing we need to do is to turn 8% into a decimal, basically. 8% is equal to 0.08. Some of you may want to remember that if you multiply 8 times 0.01, or the number percentage of dehydration times 0.01, you'll get the fraction. Now, the animal's 10 kilograms, so a kilogram is equal to a liter. A liter is equal to a kilogram, so we're going to call that 10. Multiply the 2, we get 0.8. We get 0.8 liters, which is equivalent to 800 milliliters. So this is the amount that we would have to get back to the animal, and in whatever time you determine, to replace what it had. So then we have to factor in that if you just replace the animal is going to, and it's still not drinking, it will become dehydrated. So we have to maintain the animal. So we have two requirements here. We've got the second requirement. We talked about the first. The second is the maintenance volume. So let's take the middle range of this figure that we talked about before, say 50 milliliters per kilogram. And a 10 kilogram dog would be 50 times 10, or 500 milliliters. So we add that to the 800 milliliters, and we get 1,300 milliliters, or 1.3 liters. And so that would be the amount, if we were being conservative about our rate, that we would want to administer per 24 hours in order to rehydrate the animal in that period of time. If you wanted to rehydrate the animal a little bit more quickly, you could do that part a little more rapidly at the beginning and then back off towards the end. So this is the total requirement of that animal to be, by the end of that 24 hours, rehydrated and not be continually losing fluid. So what are the routes that we can give fluids? We often forget that we can give fluids to moderately dehydrated animals that aren't vomiting by the oral route. And generally these are good for administering fluids that have, say, a high amount of sugar or salt in them, and therefore have a high caloric density and couldn't be given intravenously or sub-Q. These are obviously only for moderate fluid loss, and can't be done if the animal has too severe diarrhea, although you'll see in calf diarrheal diseases, oral electrolytes when the animal has mild dehydration is actually an initial treatment. Sub-Q fluids, the main thing we consider here is for animals that where it's practical to give the amounts that we would consider giving fluid subcutaneously. They would only be moderately dehydrated animals. And we want to use isotonic fluids so we don't have fluid shifting. Intravenous administration is a common way of administering fluids, and obviously you want to use this route in moderately and severely dehydrated animals. Obviously requires a catheter being placed and close monitoring. Intraosseous administration is used where you can't get an IV line into an animal or can't get a catheter into an animal. And this would be commonly seen in neonates, small animals, and birds. And a special note with certain species of birds, just remember that their respiratory tree is in some cases linked to the bone space, and you have to know the species where you cannot get fluids into certain bones of these species. So now we want to talk about the rates of administration. And the first thing to consider when thinking about how rapidly you should replace an animal, let's talk about the replacement dose, is to consider how quickly the fluid was lost. Was it lost in an accident very rapidly? The animal would need it back rapidly. If it became dehydrated rapidly, it would need it rapidly. If it was more chronic, could be a more slow rate to replace it. So we also consider, when we're doing IV administration, consider the severity of dehydration when we are looking at the fluid rates we might start with. And in this case, we can go a little bit slower at mild dehydration versus moderate dehydration versus all the way up to blood volume per hour for shock or severe life-threatening dehydration. And I want you to go back and remember what I said is the blood volume is anywhere between 80 and maybe 90 milliliters per kilogram. So what you're doing here is saying within 1 hour you can give the blood volume, because that's what it's going to have to re-equilibrate with the interstitial and the intracellular fluid, so you can't overwhelm that animal or you will overwhelm the heart as well. The other situation we think about are what's going on with the urine, and you need to be concerned if the animal's not making urine because its main pop-off valve, relief valve, other than the respiratory tract where it could develop edema, is obviously to make urine. If the animal doesn't make urine at all, that's called anuria, so that's no urine. If it makes only a tiny amount of urine, then that's called oliguria. And if the animal's not making urine and does not respond to your fluid therapy with more urine, then you have a problem. You're going to end up with severe pulmonary edema. So monitor the animal. And there are ways of monitoring the animal we'll talk about in a bit. Subcutaneous administration, generally 10 to 12 milliliters per kilogram per spot, and usually only use this for mild dehydration. Okay, let's take a look at the clinical signs that you might notice in an animal that has volume overload. And let's start with what we just talked about. You would expect in a normal animal, an animal that can respond, has good kidney function, it should increase its urine output. That may not be a bad thing, that may be a good thing. If the animal is not able to increase its urine output adequately, where is it going to go? It's going to go in the respiratory tree primarily. So we get restlessness and coughing, increased respiratory rate. We may even get subcutaneous edema. And in animals that get that can vomit, like the dog and the cat, they may actually vomit with an overload of their venous system. And of course, they'll have bug eyes called exophthalmos. And in very severe cases, you may see a serous nasal discharge reflecting the increased pressure on the venous side of the circulatory system. So let's look at how we can be a little more quantitative in monitoring the status of hydration and fluid therapy. And you'll see these done routinely if you're monitoring an animal that's in fluids in the clinical situation. Well, we also can look at skin turgor, just like we determine dehydration. We can continue to monitor that, and that's one thing. We can scald the chest. Remember I said if the animal's not capable of handling the fluids, it will go into the right side of the heart and end up causing pulmonary edema. We particularly want to scald animals that are recumbent on one side or the other. You want to pay attention to the animal's dependent side, and you want to probably turn them over to make sure they don't develop dependent edema. That's what is pulmonary edema. We often forget you can measure the weight of the animal. And obviously if the ins are exceeding the outs beyond where they should, the animal will gain weight. More commonly, you're going to see the measurement of PCV, which is hematocrit, and total solids, which is an indication of protein, total protein. And in critical care situations, you'll have a catheter and you can measure urine output. And you can also put an IV catheter in the basically in the jugular vein and measure the pressure on the right side of the heart, and this is an indication that when it increases beyond a certain level, we call that the central venous pressure, or CVP, that will be increased. And so that's a very refined way of trying to monitor overload of the heart. So some other considerations about how fast fluid therapy can be given. We mentioned that it's determined by, the severity of the situation. Is it an emergency? How quickly the animal lose it? And we know that we can go up to about the blood volume per hour. So let's remember that. That's blood volume. So that's why it's important to know the blood volume per hour. And of course, monitor. It takes several catheters in the jugular vein, let's say of a dog or a horse, in order to be able to administer fluids at that rate anyways. Now, we have a limitation of our rates of administration by special additives, which we'll talk about in a different unit, but we have to remember and calculate the amount of potassium we might be giving, the amount of calcium, or amount of glucose. Particularly potassium, given too rapidly, can lead to stoppage of the heart. And so we'll want to monitor the electrocardiogram in that situation, and we'll definitely want to limit the rates of administration of fluids, or even avoid giving potassium at the beginning while we have to give rapid fluids, and then consider more judicious administration of potassium at a later time once the fluid needs are met. So in summary of our unit on volume homeostasis, the major forces responsible for water movement between the compartments, intracellular and extracellular, are hydrostatic, contributed by the blood pressure, oncotic, contributed by plasma proteins, and osmotic, contributed by solutes, including electrolytes and things like glucose. The water turnover can vary per day across the species. Most animals will then drink the amount that they have to turn over during the day. So this is also similar to their amount of fluid they would normally drink. In most species, most adults in most species, 60% of body weight is considered to be water, with about 2/3 of that being intracellular and 1/3 of it being extracellular. And when I say 4% is in circulation, that's of the extracellular fluid, that's plasma. And remember that red blood cells are considered intracellular, and they would be about equal to the plasma, which adding 4 and 4% gets you about 8% for blood volume. Neonates and lactating animals would require about twofold of an adult in terms of their maintenance requirements. And fluid losses can be classified as insensible, that is, those things like dehydration loss through the respiratory tract, or sensible, things like urine and fluid in the feces. Routes of administration include oral, IV, sub-Q, and intraosseous. And when considering your replacement rates, consider the fluid compartments that you're trying to deal with, and timeline of the loss of the fluids. The slower they're lost, the more slowly they can be replaced, and vice versa. The faster they're lost, the more quickly they should be replaced. And also special considerations such as electrolytes, such as potassium, that may limit your rates of administration. We'll talk about that in a different unit.